Everybody right to go? Thanks very much for being here. There are 514 cases of coronavirus, all locally acquired. That means we now have 4,370 active cases across Victoria. 148 of today's cases are linked to known outbreaks, and the balance are obviously under investigation by our public health team. There are 3 new cases in Ballarat, taking the total active cases there to 6. With more expected in coming days. So that, I think, just confirms that there was and remains a significant challenge in Ballarat. Can I thank all of those in Ballarat who've come forward and got tested? Can I thank all the community of Ballarat who I know are doing it tough. No one wants to go back into a lockdown, but that was the advice, and if we stick together and look out for each other, as we are doing and as we'll continue to do, then the Ballarat community will get through this, just as the Shepparton community have got through it now a couple of times. Many parts of our state have had to deal with these challenges, and I'm very confident that the people of Ballarat, proud city that it is, will, with proper support, will get to the other side of this. I'll come back to some of the support we're providing, and Jerome indeed can speak to some of the other details, not just of new cases, but also some of the other testing activity and other supports that we're providing to the Ballarat community. There are 182 people who are in hospital with COVID-19. 51 of those are in ICU and 29 are on a ventilator. Of the cases who were in hospital yesterday, just to draw a line, so yesterday's hospitalisations, 87% of those were not vaccinated, 12% were partially vaccinated, and just 1 person was fully vaccinated. In terms of tests and vaccines, if I can just run through some of those numbers, 61,961 test results received overnight. That's a really strong number, and I thank each of those people for coming forward and getting tested. We're getting results back to people. Almost everybody gets their result the following day, and that's a tribute to our technicians working in laboratories and also all the people who are taking those swabs, and of course to the many tens of thousands of Victorians who are coming forward and getting tested. Thank you so much for doing that. It helps us to limit case numbers and therefore limit the number of people that find their way into hospital because of this Delta variant. There were 41,758 jabs administered yesterday, so just shy of the day before. So I think it's now our second highest day ever, so a really, really significant day, another day of almost 42,000 jabs. That's in state hubs. Of course, there will have been other vaccinations administered in other parts of the system, but our state hubs, nearly 42,000, that is a really significant number. And again, I thank all those people who are working in those hubs, and of course those who've booked appointments and who are turning up and playing their part in our race to 80% double dosed. In conjunction with our GPs and pharmacy, we are doing more first doses than any other state or territory across our country, and that is, it just speaks to this notion of there's not hesitancy out there. People are very keen to get vaccinated because I think the vast, vast majority of Victorians know that's how we keep each other safe, and it's how we get the place open, and it's how we get back to normal. There are appointments available today as I stand here right now, AstraZeneca and Pfizer appointments. Please go online and book one, and then turn up, get your jab, then a second dose, and be absolutely at the centre of us opening up and keeping people safe and well. 69.2% of Victorians aged between 16 and over, they have been first dosed. That is to say, 69.2% of Victorians have received a first dose of the eligible cohort. That means that tonight and into tomorrow we will tip over that 70% first dose mark, that gateway. That's incredibly important, and of course we're going to keep going to get to 70% double dosed, and indeed 80% and above double dosed over the journey. The fact of the matter is that somewhere across the state today, someone will get that first dose, and they will tip us over that 70% mark. That's fantastic. We've asked people to come forward and get vaccinated. We had a target of 1 million doses over 5 weeks. We've beat that. We've reached that target and in fact exceeded it and done it early. And we also said to people, look, we want to get to 70% as fast as we can first dose, so we can make some modest but significant announcements, and throughout the course of today we will tip over that 70% first dose mark. That's a great achievement, and I thank every single Victorian who's been part of that. Just a couple of points in relation to Ballarat and vaccinations. There will be increased demand there, and we want to see more and more people get vaccinated. So I can confirm that around 10,000 additional doses of Pfizer are heading up to Ballarat. Additional appointments will be made available, and not only will, I'm sure, very large numbers of people in the Ballarat community come forward to get tested, but they'll also come forward and book an appointment and get vaccinated as part of this lockdown, as part of this outbreak. Both are equally important. In many respects, getting vaccinated, taking advantage of those additional doses going up to Ballarat is very, very important. So having, during the course of the day, tipping over the 70% first dose mark, as we will, means that we can honour and indeed exceed the commitments that we had made to the Victorian community, particularly in metropolitan Melbourne just a couple of weeks ago. But I've got a list here which I will run through of the things that change from 11:59 p.m. tomorrow night. So firstly, there are 5 reasons to leave the home at the moment. There will, from midnight tomorrow night, be a 6th, and that is for outdoor social interaction. We know that this is what the community is craving, the notion of being able to see people that they love and care for, the notion of being able to visit with other people. That has to be done safely, and that's why the Chief Health Officer has recommended and Cabinet has endorsed that for this new category of outdoor social interaction, one person may meet with another person, not from their household, for a picnic or another outdoor activity, regardless of whether they are vaccinated. Those who are fully vaccinated can meet in a group of up to 5 adults, plus their dependents, from as many as 2 households. So if you're not vaccinated, or you only have 1 dose, you can, as a group of 2, go outside and have that social interaction outdoors. If you're fully vaccinated, that number goes from 2 to 5, but it is a maximum of 2 households. So we will see from 11:59 p.m. tomorrow night, so into the weekend, we'll see groups of people outside enjoying each other's company in a safe way. The groups are larger if you're vaccinated fully, because there's protection that comes from being fully vaccinated. If you're not vaccinated, by logic tells you, and the Chief Health Officer has confirmed, that group needs to be smaller. It needs to be just the 2 people. This is what Victorians have craved for a long time, and we're pleased to be able to take these modest but I think significant steps to provide this outdoor social interaction. It needs to be done safely, it needs to be done carefully, but these are important steps for us to take today. The time permitted will double from 2 hours to 4 hours for both exercise as well as the outdoor social interaction, and the distance you can travel from your home doubles from 5 kilometres to 10. So those 3 steps are in line with what we had spoken about being able to deliver. In fact, they're indeed beyond what we had indicated we would deliver a couple of weeks ago. We're not overselling it. They are modest changes, but they are significant, and I'm sure people will avail themselves of those options that have been not safe and have been denied to the community for many weeks now. Just to go through the rest of the announcements as they relate to both metropolitan Melbourne but also regional Victoria. 2 people will now be able to train outdoors with a personal trainer. Skate parks and outdoor communal exercise equipment will also reopen. Child minding for school-aged children, so that's in-home child minding. Some of those, I think they've been described many times as a grandparent-type arrangement. That'll be extended. At the moment, it's only for households where there are 2 authorised workers. It'll now be for households where there is just 1 authorised worker. Up to 5 people will be able to attend an entertainment venue or physical recreation facility for the purposes of broadcast of either a performance, a class or a concert. Real estate inspections will resume by appointment only. The property would need to be vacant at the time of the inspection. The agent will stay outside. The prospective tenants or those who are seeking to purchase the home, they will be able to move through the home and inspect it. The residents there can't be at home. It doesn't have to be a vacant property, but for the time that the inspection's going on, they need to vacate. They need to move out for that hour or however long it takes. Limited and with COVID-safe rules, I'm sure the real estate industry and all of those who either want to get into the market or are looking to sell or have new tenants move into their property will be very appreciative of those changes. And we'll have a conversation, as we always do, with that sector to make sure they fully understand what those rules mean. In terms of construction, we've had a lot to say because we've had to, on the basis of case numbers and the amount of infection that's been going on in our construction sector. What I can announce today is that construction workers statewide will need to show evidence to their employer that they have had at least a first dose of a coronavirus vaccine by 11:59 p.m. on the 23rd of September. So basically construction workers have a week to get, if they've not already got a first dose, to go and get a first dose of any of the vaccines that are available, and they will need to demonstrate to their employer that they have done that. We've seen too many cases in construction. Vaccination, first dose helps, second dose is obviously better, but in order to strike that balance and have maximum protection but at the same time keep that industry going and all of those jobs and livelihoods, trying to protect them as best we can, first dose by next Thursday is mandatory. That is required. No debates entered into. If you've got health reasons, fair enough, but people need to go and get vaccinated, and Jerome can speak to some of the priority treatment that we'll provide and some of the ways in which we'll try and facilitate that as quickly as possible. As I said, there will be some limited medical exemptions and things of that nature, but that industry needs to take this seriously and go and get vaccinated, go and get your first dose if you haven't already, otherwise you will not be permitted to work. That is not a choice that anyone should make. They should in fact put their safety and the safety of the community first and go and get their first dose. Now, on from that, and I know this will be, there'll be significant impact from this, but we've seen many seeding events and transmission events that relate to construction. Ballarat is essentially one of those examples. But from 11:59 p.m. Tomorrow night, construction workers will no longer be able to cross back and forth over the metropolitan regional boundary. That is a challenge, I know, but we're just seeing far too many events, and even people who have COVID safety at the front of their mind, if you're travelling back and forth from metropolitan Melbourne into the regions and back again, then the virus will hitch a ride. That's exactly what has happened. And we've seen not only what's happening in Ballarat, but we've seen it in a number of other regional communities. If we finish up with cases that are running wildly in regional communities, then we have no choice but to shut those communities down. There will be support for anybody who is adversely affected by this. I apologise that this is the only way forward. It's going to be disruptive for a number of people. There are income supports there for you. This is the advice, this is what we must do to try and limit the number of cases. I don't want to see a situation where there are more Ballarats, more Sheppartons. Albury, for instance, today the New South Wales government has had to have a lockdown there. We want to try and limit the impact on regional communities, and if we see all this construction movement, we will see more cases, and that will mean we have no choice but to lock down bigger and larger parts of regional Victoria. This is about safeguarding what regional Victorians have built. I apologise for the inconvenience, but this is the advice on what is safe. They're not easy decisions to make, but there's no alternative. There are a range of other issues around deliveries and who can come on site and who can't. We'll be working with the building sector, with the construction sector, so they fully understand all of those issues. Moving now to regional Victoria, who, as you know, we did some easing there not that long ago, so there's not, I don't think, a great expectation that we were going to take enormous further steps. But with the exception of Ballarat, because of course Ballarat is now operating under the same rules as Melbourne, but for the rest of regional Victoria, I can announce that again from 11:59 p.m. tomorrow night, again all on advice from the Chief Health Officer, gyms and outdoor and indoor pools can reopen. That excludes spas, saunas and steam rooms. They'll reopen with limits. All of those sectors are well aware and I think have operated in one form or another with rules, with COVID-safe plans. It'll be no different. We'll communicate with them and there'll be wording up on the website so people have got absolute clarity. But it'll be things like density quotients, 1 person to 4 square metres. But it's safe to do that now given there are so few cases in regional Victoria, but we've got to keep it that way, which is why we're making other difficult but necessary decisions. Hydrotherapy and swimming lessons can occur. Again, there'll be limits and safety protocols. Tour buses can operate, again, with limits. You've got a list there in front of you. I'm not, again, overselling what this means for regional Victoria. They are small steps, but they are safe steps to take. That's the view of the Chief Health Officer, and it's on that basis that we have endorsed this opening up. If I can just go back to the top, we've got more cases today, but we have a very high test number. We have a very high vaccine number. We said we wanted to do 1 million vaccines, million jabs in 5 weeks. We beat that. We did that ahead of time. Thank you to every Victorian who's been part of that. We said that when we got to 70% first dose, we'd be able to do some modest but meaningful things. And that's exactly what we're announcing today. Doubling the distance you can go from your home, doubling the time you can spend out of your home, and also the notion of this outdoor social interaction, the thing that so many people have talked to me about, the thing they're craving most, seeing those they're closest to, getting out and about, being able to, in a safe way, engage with others beyond their household. Of course, you'd always like to do more, but we have more cases today than we've had for a very long time. We've got more people in hospital than we've had for a very long time, and we have to balance this out. We're not at 70% double dose, we're at 70% single dose, and there is a big difference with that. On Sunday, though, we'll be back to talk about what the rest of September, October and November looks like, and indeed beyond that. And it won't answer every question, and it won't necessarily provide, every single rule change for months and months and months. It'll be a meaningful document, and it'll give people a really clear sense of what we're working towards. There'll be caveats, and there'll have to be, that's just the nature of this. It is uncertain. But these are really important steps. This is a good day because exactly what we said we wanted to work towards, we've been able to achieve. 70% first dose, 1 million jabs in 5 weeks. This is a credit to all Victorians. But those numbers are growing, and that's why these steps are safe. And to do more than this, particularly if you were to do substantially more than this, despite the fact that's what we want, all of us, that would not be safe, and that would not be endorsed by the Chief Health Officer and the public health experts. They are not the decisions to make at this time. They will just drive more cases, more people in hospital, and it'll make the job of our nurses even harder than it is right now. We talk about testing, particularly in Ballarat, and I think we've got 4 additional sites opening up today, as well as to speak to cases and some of the architecture of this outbreak. I'll now throw to the COVID commander, to Jerome, and then we'll take any questions you've got.
Thank you, Premier, and good afternoon. 514 cases of a significant caseload that we're now dealing with across Metro Melbourne and a few cases in regional Victoria. In addition to the 3 cases in Ballarat, and I'll talk a bit more about those in a moment, we have 7 further cases in regional Victoria. That makes 10 cases in regional Victoria in total. Those 7 are 4 cases in Mitchellshire, 1 in Murrindindi, and 2 in Geelong, Greater Geelong. All those cases are connected to existing known clusters, they're primary close contacts, and as such we're confident that the current isolation protocols for those cases are sufficient. And of course we continue to support those people in regional Victoria and encourage particularly people in Geelong, Murrindindi and Mitchellshire to continue to come forward to get tested if they have any symptoms whatsoever. In terms of the rest of the cases in Metro Melbourne, we obviously have a very similar geographic spread that we've seen over the last couple of weeks. So over 61% of the cases are in our northern suburbs, so 317 cases across suburbs including Craigieburn, Roxburgh Park and Glenroy. Around a quarter of our new cases are in the western suburbs including Truganina, Altona North and Deer Park. We have 46 cases in the southeast, in Dandenong, Keysborough and Clyde North, and that does represent now an significant increase in the southeastern suburbs where we're getting a little bit more concerned. And then we have 14 cases in the eastern suburbs, including Doncaster and Donvale. There are 3 further cases we're just trying to nail down exactly where they are. We'll update those in the CHO release. In terms of the overall spread then of activity, we continue to see good work and good progress being made in the western suburbs, and my thanks to all the local teams working so hard across our GPs, primary health and of course Western Health. Some very hard work going on there, and we're seeing some good stabilisation of numbers in that area. Obviously significant growth continuing in the northern suburbs, a lot of focus on a number of different clusters of concern, still very concentrated in a number of key suburbs. And we're seeing an underlying growth within the southeast. So I'll particularly call out today, if you're in the southeastern suburbs, around Dandenong, around Keysborough, around Clyde North, if you've got any symptoms whatsoever, well, please just check those exposure sites. We really need to see people coming forward to get tested in that part of our city. We think we're starting to see some seeding out now, particularly from essential workers moving across the city, moving from the north and west into the southeast, and obviously we're keen to stop it wherever we possibly can. In terms of Ballarat, I was able to get to Ballarat this morning and see the setting up of 3 additional sites today, 1 site yesterday, and there's another site being activated for tomorrow. So a significant testing drive going on with literally hundreds of people now working across Ballarat, from Ballarat Health, the City of Greater Ballarat Council, and of course colleagues from the Department of Health. And my thanks to all the local players there for getting together and putting a really swift response together to the emerging number of cases. We now have 6 active cases in total that we're aware of in Ballarat. Yesterday we reported 4 in total. That includes 1 further household contact of the original construction worker, 1 social contact of the construction worker, and that was a case I mentioned at the presser yesterday afternoon. But we also have 1 unlinked case, a new case not connected, we believe, to the cluster of 5 that we understand. This unlinked case has been infectious since last Tuesday and has had a number of exposures across Ballarat. They are in a different part of the city, and they may help us explain some of the wastewater detects we've been seeing over the last few days. More exposure sites will be coming on stream during the course of today, and again, of course, we'll be doing the work with him and his contacts to establish any other further exposures. I am expecting to see some very busy testing in Ballarat over the next few days. Some long queues there already this morning. Well over 1,000 tests completed yesterday with the existing 3 sites that we had up and running. And my thanks to everybody who came forward yesterday to come and get tested. Today we have set up additional sites at Victoria Park on Military Drive, and that will be open until 8 p.m. tonight. And there was a pretty healthy queue there this morning. We'll also have another, there's a walk-up site opened up this morning at the Ballarat Aquatics and Lifestyle Centre on Gillies Street. And there's another drive-through being built as we speak at the Ballarat Sporting Centre car park, and that'll be open at 4 p.m. tonight, and that'll be open till 8 p.m. tonight, and of course will be open tomorrow and over the weekend. That's in addition to the existing sites we have in Ballarat, including the respiratory clinic on Dana Street, the Foresight drive-through on Skipton Street, and the drive-through site at the Marty Bush Reserve at the Sebastopol Footy Club. And again, my thanks to all the teams that are working so hard to get this done. I would urge, in terms of people in Ballarat, if you are symptomatic, please get tested at any one of those sites today. If you've been to those exposure sites or you've had a message from us that says you might be exposed, then please again come forward to get tested today. If neither of those categories apply to you, if you just want to get tested because you're a bit concerned or you want to just see what's going on, please hold off for a day or 2. Let's get people to come through over the weekend to do that. I really want to get those who are symptomatic and most at risk to get tested today, so we can establish quickly the size and scale of this outbreak. In terms of other activity sites, obviously we've spent a fair bit of time over the last couple of weeks talking about the Box Hill construction site. We have another 1 positive case from our day 13 testing. That takes us to 147 for the outbreak so far. But we are now starting to release the primary close contacts with that day 13 testing. So over 200 people released from their isolation around that construction site. And again, my thanks to them for isolating so well over the last few days. Obviously, we'll continue to work with those who continue to isolate. We also have more cases at the Fitzroy Community School. That's now up to 46 cases in total. A further 8 cases have come forward. And again, my thanks to the school community for isolating and locking down and doing all those COVID protocols that I'm afraid are so important at this point in time. But I'm pleased to confirm that no new cases so far at V-Line. We've now worked our way through all their primary close contacts. Of course, over 200 staff are still continuing to isolate, and also pleased to see some services returning. For those planning to travel on the V-Line network, please do check their website before you do so. Finally, of course, I'm pleased for all of us across Victoria with the welcome return to Shepparton into the network. We would ask people to please be very mindful of any symptoms that you get. Get tested as soon as you possibly can if you're at all concerned about your health, and please continue to check all those exposure sites. And finally, in terms of vaccination, in addition to the 10,000 additional Pfizer doses that we'll be deploying into the Ballarat area over the coming days and over the next couple of weeks, we have 360,000 people booked in for their vaccine appointments over the next 2 weeks. That is a fantastic result, and it's a really strong build on the 70% first dose vaccinations we've achieved already. We still have 34,000 open first dose Pfizer appointments available over the next 2 weeks across the state. Those doses are available today, those appointments are available today. I'd urge people, please, if you're not part of the 70% that's been vaccinated yet, please come forward and get your vaccination done. There are also 18,000 first dose AstraZeneca appointments available, again, across our 55+ state clinics. With that, I'll hand back to the Premier for questions.
Thanks very much, Jerome.
Just on people prove that they've been fully vaccinated.
We'll take you back to the first point. We are not going to have police in every park. We're not going to have police out there requiring people to prove that they've been vaccinated. We are asking people to gather in groups of no more than 5 adults from 2 houses, only if you have got both doses, if you are double dose vaccinated, fully vaccinated and have the protection of that. There's a degree of good faith in this. I'm asking people to do the right thing. If people do the right thing, then we'll be out of lockdown sooner. If people just, ignore these rules, whichever rule we're talking about, whether it's this new structure to allow people to go and connect with the people that they're missing the most in as safe a way as possible, then that'll mean more cases, it'll mean more people in hospital, and it'll mean that we're locked down longer. There are limits, and we can't literally have a situation where we are going park by park, picnic by picnic. So that's not an invitation to break the rules, that's just an acknowledgement that the choices individuals make, if they're good choices, we'll keep the numbers down and we'll get open and get free sooner. If they're bad choices, then that'll just feed cases and that'll make all the work we're doing even harder.
Just on construction, is it both ways? So
yes, it is both ways.
Okay.
It is. Because the virus catches a ride no matter which way you're headed, basically. And I know that is going to be significantly challenging for a number of people who don't necessarily live in the same place where they work. They're travelling back and forth. We'll still have COVID-safe ways in order to deliver supplies. That's much more a matter of freight, but we won't be seeing people who are driving, for instance, and taking timber from Metro Melbourne to a regional building site, for instance, or concrete or gravel or whatever it might be. They will not be going on site. They will be doing that drop-off. It's almost a kind of contactless click and collect type arrangement. We've already had lots of conversations with the construction sector. It's a very diverse sector. These rules will mean different things for different parts of that industry, but this is what's required in order to keep them operating at 25%. This is what's required, certainly, if we're going to countenance growing that and going to a higher number than 25% in the weeks to come.
The one-dose rule, is that for construction? Who's that enforced by? Is that enforced by the person in charge of the site, or will WorkSafe be going out?
Yeah, sure. It'll be a joint effort, but the requirement is that the employer does not have unvaccinated people on site. So the important thing here is that if you're in this industry and you want to get about your business, if you want to get back to 50 and 75 and back to normal as soon as possible, you've got to stay open now. That's the first step, and the key there is to be vaccinated at least 1 dose, unless you've got a medical exemption, by midnight next Thursday. I know that's asking a lot of people, but that's what's at stake here. We've seen many cases, and we have to make sure that we're not seeing more of those cases in this industry.
Premier, you did mention it is a very modest easing of restrictions. We've all expected that, but why no lifting of the curfew when our friends across the borders have been easing these restrictions? I think a lot of Victorians would like to know.
Well, Victorians can be very clear about one thing. We act on health advice, and I have no advice to remove the curfew. The curfew works. The curfew means less people are out visiting people in their homes, doing things that are against the rules. And we've seen, whether it be road traffic data down by 10, 15%, and public transport data down by 10, 15, even more during those curfew hours. I know it's inconvenient. There are probably a lot of people out there who want to go shopping at 1 o'clock in the morning. Well, no, you're not. That's not what people do at 1 a.m. or 2 a.m. or 3 a.m. People are out. Some were out visiting other people, spreading this virus against the rules. The curfew is a decision of the Chief Health Officer. It's made. It's proportionate to the task the challenge that we face. And I apologise to people if they're inconvenienced and they can't go shopping at all hours, and they can't go and do their exercise or their now outdoor social interaction in the middle of the night. This works, and I've got no advice to take it off, and therefore it remains on.
On the outdoor health advice that's been provided to New South Wales, do you think we should be I understand they're under...
Well, we're not in New South Wales, and you can speak to New South Wales about what health advice they get, and you can also speak to them about whether they follow health advice, and all those questions I can't answer for decisions that the New South Wales government make. I'm here to talk about the advice that's been provided to us. The Chief Health Officer is off very busily working on the roadmap today. He'll be back tomorrow. and he'll be able to, and these things don't come into effect until midnight tomorrow, so you can quiz him to you know, as much as you want to, but I've got no advice to remove the curfew, and therefore the curfew remains on, and the curfew works. We have definitely seen less movement on public transport and on our roads during curfew hours. And again, it's not about being critical or cynical. We know from contact tracing interviews that people are breaching the rules, and a fair bit of that activity was in fact occurring during the curfew hours. Now people have to make a judgment. Is it worth breaking the rules? If I haven't got a lawful reason to be out, I've got every chance I'm going to get pulled over, and I'm going to get asked, why are you breaking the curfew? And if you don't have a good answer, then there's a very significant fine. And that drives much safer behaviour.
On the outdoor social changes, Premier, what do the Burnett people and public health people believe the impact on cases might be? Is there a belief that it won't affect case numbers, or just that it will increase it but at a manageable level?
The Burnett modelling will be far more, will be a far bigger part of the roadmap announcements, which are much more significant than these modest easings. When it comes to modest changes, so not roadmap changes, but the stuff I've announced today, the public health team speak with Burnett and speak with many others and get input from lots of different places about what's safe, what it might mean from a caseload point of view. I think Burnett comes into its own though, much more in relation to bigger pieces of the puzzle and bigger announcements that we'll make on Sunday. These are modest. We've never tried to oversell them, but they're not unimportant. They are meaningful, but they're not meaningful in terms of adding, you know, disproportionate amount of risk to having more and more cases.
And do you think this is fair for those under the age of 40 who haven't had as much time to get double dosed?
Well, this is what's occurring. I've just been urged to do something New South Wales is doing. I would point out that whilst we make our own decisions, these are the sorts of that double vax protection. That's an acknowledgement not just in Victoria, that's acknowledged in New South Wales as well. I'm sure it's acknowledged in many parts of the country that there's a difference between being fully vaccinated and having only one dose, and there's certainly a difference between having one dose and not having a dose at all. We will get to a point where we we will have more and more people that are fully vaccinated. They'll have more options than if they're not, and we will, you know, it's not that far away before we will get to that 80% first dose. We might even exceed that. On Sunday we'll talk about other freedoms and other things that we can do at other points, but at the moment I can't pretend that a person who's double vaccinated, so 2 doses, is as protected and as safe from a transmission point of view as those who aren't. I'd love to, well, on the issue of fairness, I won't dwell on it too much because we can't change it, but we've had a bit to say, and we've laid out the facts of the matter, that there was vaccine that should have come to us that didn't. But I can't change that. All we can do is get as many jabs into arms as possible, and every time we set a target, we beat it. When I say we, the great people of this great state. So we've got to push on to 80% first dose. If we can go beyond that, we will, and then we'll have many, many more options.
How do you feel about that, Premier? Because New South
fully vaccinated across the border.
Sorry, no.
Construction workers who are fully vaccinated.
No. Your vaccination status, in terms of this is how serious things are in construction, and this is how serious it's been in relation to, because it's such a highly mobile workforce. This is how serious it is. The vaccination status does not give the Chief Health Officer sufficient confidence to allow that movement. So there's no movement between metro and regional and metro for the purposes of the construction industry. I know and understand that'll be a significant impost. That's the advice I have, and none of us are in a position to say, oh well, that's inconvenient, so we won't follow that. We don't want to see more and more of these building sites falling over with dozens and dozens of cases, when it only takes a handful really to potentially have a large regional city or a large part of regional Victoria shut down again. We've got to safeguard what regional Victorians have built. Of course there are income supports for those who are going to be down hours. We'll do whatever we can to support those people, but this is the advice, a very, very considered advice of the Chief Health Officer.
What's your view, Premier, on reducing the time between the first and second jab of the Pfizer dose? Could that be reduced to 3 weeks to get us to that 80% target quicker?
Well, we're in a race to get as many people vaccinated as fast as we can. First dose, and again, I'm not a doctor. Those decisions are not made by politicians, they're made by experts, but let me just explain my thinking. This is what you asked me. The difference in protection from no dose to 1 dose is greater than the difference in protection from 1 dose to 2. We want everybody to get a second dose, let me stress that. But at the moment, we're doing more first doses than any other part of the country, and we've got to keep pushing. We're not to our 80% yet, and in fact, we want to go beyond that. If we can get 85, whatever the number is, through the first dose, we know that literally every single one of those people will come back for a second dose, and that'll mean that we will be above the 80% marker, hopefully, and the sort of protections that come from that are really, really significant. So I've got no advice to change that interval, and the more people who get a first dose vaccination as fast as possible, the less cases we'll have as we move towards getting to 80, and the number of cases you open up with is very meaningful in terms of how much strain there is in the health system, how fatigued our nurses are, how much virus is just out there. So the baseline, where you start from, matters. Doherty has confirmed that. That's the position that New South Wales and Victoria are in. So we've got to do everything we can to have less cases in this intervening period as we get to 80. And that means first doses, as many first doses as we can. If I got advice though, Stephen, if I got advice to change the interval, then of course we would, but we don't have that. We don't have that advice now.
Just on 80%, the AMA has called for COVID restrictions to remain unchanged until 2 weeks after 80% of people over the age of 12 are fully vaccinated. But this wouldn't be forecasted until at least the end of November. So is this some type of advice that you would take on, or would you strike that balance?
Well, let's be very careful. I suspect that at the heart of your question is whether we'll be compliant with the national plan. Yes, we will be compliant with the national plan. The AMA have a view, and they're not wrong to say that when you get your jab, you don't get instant protection. It takes some time before the vaccination is fully effective in protecting you from very serious illness. The national plan is very clear. There are some steps you can take at 70, and there are much bigger steps you can take at 80. And I'm not going to pretend, just like today, we're not pretending that 70% first dose is the same as 70% second. I'm also not going to pretend that 70% double dosed is the same as 80. It isn't. The Doherty modelling didn't say let her rip at 70. They put the number in there at 80. That's another threshold. And indeed, if we can exceed that, then we absolutely will. But look, we will have a roadmap out on Sunday, and that will speak to you about all the different steps we intend to take. They will be absolutely consistent with the national plan, and 70 and 80 will be the important markers. But the national plan itself, that placemat document, speaks. There's bigger steps you can take at 80 than there are at 70, and that's just what common sense tells you. That too.
Will the roadmap include interstate travel?
Well, we'll have more to say about borders. Some of those things are very uncertain because we don't know what's going on in other parts of the country. I know that there's a lot of interstate travel that's not unimportant, but I think that our focus at this stage, and the document will speak by and large to what happens within our state. But look, I want freedom of movement. I want people to be able to go wherever they need to go as soon as is safe. I can't speak for what happens in other states and what their restrictions on Victorians might be or might not be. And as far as international borders, obviously that's a matter for the Commonwealth.
Will the roadmap have clarity around when Victorians in New South Wales can come home?
Yes, we'll speak to that in great detail, and we will outline a plan to get those people home. We've already got the pilot is well and truly underway. That's going well.
Will the pilot be ready by Sunday?
Well, no, it's happening now. So we're running a pilot right now with that G2G tech. There's some other work going on in Adelaide. That's more for the international people. We're doing this. This is not for people coming from other countries. This is being used as part of our pilot work, which I'll report to National Cabinet on tomorrow. This is for those returning from New South Wales. The people that were on the border. The risk does get higher as we get closer to Sydney and right into Sydney. But we're confident that we can get those people home, and I'll have more to say about the timeline on which that will happen on Sunday.
Do those Victorians need to get into the border bubble before they come home?
No, it'll be things like getting themselves vaccinated, and then there'll be a series of tests that they'll need to do, and they'll obviously need to produce negative tests, and then we'll be able to have them come back. There will be some technology, and they'll be checked on. They'll need to do the right thing. They'll need to isolate at home for a period of time, and we'll have more to say about that once the weekend's here.
How many cases we had where there's been movement by construction work between the regional and metro boundary that's actually led to a cut?
Yeah, sure. I don't have
this rule.
Yeah, I don't have an exact number, and there'll be some cases that will be attributable to that off the back of today. I don't think Jerome probably may not have a number either, but we can certainly get you one. But
there are cases though that's led to this rule.
Yeah, there are communities like Ballarat and other parts of regional Victoria that are, testament to the fact that it doesn't take many cases to have to lock down. If they fall in exactly the wrong way, where you're not certain about, close contacts, where they might have been, sewerage testing is pinging as well. You can sometimes have to make one of those very difficult decisions really fast, and we want to try and avoid that as much as possible. And what we know from the data and the advice coming to us from the Chief Health Officer is that sort of movement presents a really significant risk to the open status of regional Victoria.
Tony, what hope do you have that these freedoms will possibly negate the impact of the protest that's planned for Saturday? Would you rather see people go to a picnic than protest?
Well, yeah, I would. I'd rather see people follow the rules rather than break the rules and very selfishly put other people at risk. You don't have to look very far to see stories, not so much in our country, but in other parts of the world, of people who didn't think it was real, only to find themselves on a machine to breathe. And their attitude changes, and they have very different view then. There's also people who didn't think vaccinations were something they should do, and now they're in a hospital bed, very, very sick, and they have a different view now, and they call for people to get vaccinated. I wouldn't like to think that anybody who's coming out to protest, is doing so with just a disregard for the safety of others. Like, I get that people have strong views about where we're at, and no one's enjoying this, no one. But no one's got the right to put somebody else in hospital. No one. As for some commentary today about what Victoria Police have asked for, the Chief Commissioner has come to me and said, I want public transport off. And I've said yes, because I don't want a repeat of what occurred a couple of weekends ago. Now, we may be able to avoid that, we may not. Again, I apologise to anybody who will be inconvenienced by public transport changes during those hours of 8 to 2. But it's not the government that's inconveniencing you. It's potentially thousands of people who very selfishly are deciding to protest, as if protests work against this virus. They don't. They don't. So I would, and what's more, and just to be very clear about this, our government has a very long track record of when the Chief Commissioner needs things, then the government provides those things to the Chief Commissioner. The scenes just from a few weekends ago were not only ugly, they were unlawful, and we've all got to take every step we can to try and avoid that. And the Chief Commissioner can speak to the intelligence and can speak to what he knows of what's planned, but it would seem that there are some people who are keen to come out on the weekend with the sole purpose of being violent. And on that basis, we need to follow the Chief Commissioner's advice and give him what he's asked for.
Just that there are thousands of people who have vaccine appointments who need to go to work in the city on the weekend.
And
is there any alternative for them?
Well, no. Look, I've heard it said, that this is heavy-handed. That's nonsense. It's what the Chief Commissioner's asked for. In terms of inconveniencing people, I apologise if anybody is inconvenienced by the fact that we have to respond to what may be a very dangerous event, if it's anything like what it was a couple of weekends ago. Yes, there'll be inconvenience, but I can tell you from a number of testimonials direct to me from people who got caught up in those awful scenes a couple of weekends ago, that's pretty inconvenient too. In fact, it's frightening, very frightening to be caught up in that. So Victoria Police members are going to do what they always do. They're going to put themselves in harm's way to keep the rest of us safe. And the least we can do as a community and as a government is give them the resources and the powers they ask for. Yes, it will be inconvenient, I apologise for that, but, it's not the government that's causing the inconvenience. It's a bunch of people who think that protesting is a smart thing to do in the middle of a pandemic.
How many thousands of appointments for vaccines we have in the city?
No, I can try and come back to you, but again, we will make any and all arrangements we can to try and support those people. We're going to have to get our staff in as well to hospitals and places like that. This is not by choice. This is not I don't know that it would be a good outcome if, when confronted with clear intelligence that some people are intent to be violent, if I was to say, no, Chief Commissioner, I won't give you what you've asked for. Like, I don't think that works. That's not a good way to do these things. I wish we didn't have to turn off public transport for those hours. I wish no one was inconvenienced. I wish the protest wasn't happening. But it would seem some people are intent on doing that, even though it's against the rules. It's selfish and it's wrong.
Does it set a troubling precedent for future protests that this is an action taken by the government? And does the Chief Commissioner get anything he asks for when he makes a request?
No, well, the Chief Commissioner, I think at the heart of your question is that the Chief Commissioner might well make an unreasonable request. In my experience, the Chief Commissioner considers very carefully what he asks for, and then the government considers those requests. And if the Chief Commissioner says to me, I need these things to keep people safe, what I'm indicating to you is my answer will invariably be yes. We always reserve the right to have a discussion though, so I wouldn't read anything more into it than that. And as far as precedents for future protests, I don't understand that question, frankly. These are unprecedented times. It's a 1 in 100-year event. It's not safe to protest. All you'll finish up doing is spreading the virus. Then, of course, there's other people who are intent to be violent, it would seem. Pandemic or no pandemic, that is never acceptable. Never. Police have made it very clear to me, and I think to the broader community, that the stuff we saw a couple of weekends ago is some of the ugliest stuff we've seen in 20 years. 20 years. So I just urge people, don't be out protesting. Don't be out protesting. It's just not the time to do that. It just isn't. It's not safe.
Did Cabinet sign off on that, or was that your call?
Sorry?
To shut down
No, the CMC...
the public transport network.
The Coordinating Ministers Committee of Cabinet have made that decision.
Just a couple of questions on restrictions.
Sure.
Firstly, real estate. Will photographers and interior decorators and the like be able to go into those vacant properties and get them styled for selling?
It's a very good question. I don't have a definitive answer on that, but I'll come back to you
and then
on that.
On golf and tennis, will that be allowed from?
Not as part of these changes, and we did indicate that we would try and go further. I think Victorians would remember, and just for the sake of clarity, a couple of weeks ago we said, look, if we can get to 70% first dose, we'll look at doing 10Ks, we'll look at doing 3 hours, those sorts of things. We then did say, you're right to point it out, we did say if we can go further we will, and outdoor rec would be an area that we would look at, outdoor being safer than indoors. However, with the cases as they've grown, and the fact that you can't allow everything, you can't agree to everything, we essentially have prioritised family time, so people being able to connect with another family, another household, outdoors. That is a significant step today. If you were to go and do a whole lot of other stuff, then I dare say the advice from the Chief Health Officer would have been, well, in fact it is, that's too much. That's too much movement, and that will drive caseload. I know it's very hard because whenever you have a list, there are some things that are on it and there are some things that aren't. I would love nothing more than to be able to go and hit a golf ball, but that's not safe. It will be though at a point in the future, and on Sunday I'll have more to say about things like golf and tennis and fishing and all sorts of other things.
Can we see small gatherings?
When New South Wales announced they were going to introduce small outdoor gatherings, you said the national plan was not a national plan for picnics. Was that a bit of a cheap shot, given that you're announcing pretty much the same easing of outdoor gathering restrictions?
No, it was not. Let's be really clear about this. No Victorian gave up extra vaccine so that, New South Wales could be enjoying things that Victorians cannot enjoy. That was the point that I was making, and I stand by that point. What's occurred, of course, inconveniently for that line of argument, in the intervening period, it's become clear just how many doses we've missed out on, with preference to New South Wales. If you ask me to apologise for the announcements we've just made, no, I'm not doing that, nor am I going to walk back what I said previously. I stand by that, absolutely. When you get priority treatment, then I would just say you need to exercise that cautiously, and you need to value the fact that you've been treated special. I made this comment, exactly the same comment. I made exactly the same comment to the PM, and I made the same comment out at the Western Bulldogs. I remember it well, and I stand by it.
Are you saying you wouldn't have made the same decisions about granting Victoria's gathering?
No, I'm simply saying that I'm the Premier of Victoria, not the Premier of New South Wales, and I've got too much to worry about without worrying about what decisions they make. But, you know, I think there was at that time in the community a sense of absolute frustration that extra doses had gone and that announcements are being made about things that can only happen when you get to vaccination thresholds that can't happen in Sydney, that can't happen here. Like, you know, we have since learnt that it wasn't just the doses that we knew about, there was many, many more than that. But again, we can't change that. That's happened. What's also happened in the intervening period is literally hundreds of thousands of Victorians have gone and got vaccinated. We're now through the 6 million mark. That's a fantastic effort.
How do you feel then that New South Wales will have 70% of their state fully vaccinated by October the 11th and we're lagging well behind?
Well, no, I wouldn't say we're lagging behind. Like, we're getting stuff in arms as fast as it comes to us. I just remind you that we said we'd do about 25% of this work. We're doing 50% of it. Like, I wonder where we'd be if the state government wasn't running 55 hubs, if the state government wasn't doing 50% of the work, if we hadn't set a target to put 1 million jabs in 1 million arms over 5 weeks. We wouldn't be celebrating 70% first dose. We'd be, I don't know where we'd be. We'd be a long way behind. So I think, look, Victorians are doing a fantastic job. We are getting the jabs done as quickly as we can based on supply. The good news is that there's more supply coming, whether it be Moderna into pharmacies, or I think we'll get confirmation very soon about what the next month looks like. I'd be here today talking about our next, you know, million or whatever the targets were. I can't do that at the moment because the Commonwealth still haven't confirmed for us what we're getting in October, but we'll get that confirmed soon. But look, you know, Sydney's where they're at. The most important thing for Victorians to do is to focus on getting vaccinated, getting tested if you're sick, and the roadmap on Sunday will speak to that.
Construction edict. John Sector, the head of the construction union, said this week that he was against mandatory vaccinations. He preferred to have a conversation with people. This is basically a temporary mandatory vaccine edict. So how are you going to manage that with the union, big union, who are seemingly opposed to it?
My position's very, very clear. If you want to know what the CFMEU think, go and have another chat to John. We have been speaking with the unions, we've been speaking with employers, we've been speaking with this sector in all of its diversity, and the decision is that construction workers, if they want to work and be part of that 25%, they need to be vaccinated 1 dose by midnight next Thursday night. If they're not, they won't be coming on site. That's a plan to keep the thing open, rather than doing what you could do, and that's to say, oh, well, we're just going to close it down to zero. You know, the other thing too is that these first doses, for those who haven't had a first dose, they're an investment and a kind of down payment, if you like, on getting to 50% and 75% in weeks and months to come. Look, there'll be lots of different opinions. People are entitled to those opinions, but the announcements I've made today, I wouldn't describe it as an edict as such. It's not a term I'd use, but you did in your question. I think it's an important decision that puts safety first.
Premier, when do you think we'll get to 70% double dose vaccination?
Well, there's lots of different websites, lots of different reports. A lot of it is kind of speculative. You are predicting what human behaviour looks like over a period of time. We're very keen to get there before the end of next month, and there's some reports that we'll be able to do that. But that's really in the hands of every single Victorian. The other thing too is that there'll be some milestones along the way. So there'll be 80% single dose, may even be more than 80% single dose, which would be terrific in terms of a marker for where we're going to get to on double doses. Let's wait and see how things go, but it won't be for want of trying. We've got 55 sites open. We're putting pop-ups into, you know, priority postcodes, 100 different postcodes where we think there is a need to take the program to people rather than the other way around. You know, we are doing everything we possibly can, and again, we are essentially doing double what we signed up for. We're happy, we're fine to do it, but we do need people to come forward and book those appointments as soon as possible. And as Jermaine said, there's something like 30,000 first dose Pfizer appointments, 35,000 I think you said, and a smaller number of first dose Astra appointments, but hopefully they can be snapped up really quickly.
What's the average time that we will get?
And sorry, just to finish on, that's sort of 26th, around that time. That's what people are talking about, so toward the end of next month. And then 80% can, on some estimations, come only just a matter of weeks later. So at this stage, the push is on to get as many first doses administered, because we know that if we can get people to come for their first dose, 99.99% of them will come back for their second.
Small gatherings outdoors at pubs for grand final, do you think?
Sorry, I missed the...
At pubs, grand final weekend, maybe in beer gardens, small gatherings, pubs.
I don't. Well, in regional Victoria, they would be allowed within the limits that we've set, but that will not be possible in metropolitan Melbourne.
And are you considering...
Not unless there's a very big change in advice, and I don't believe that's going to be coming between now and the roadmap's release on Sunday. It wouldn't be safe. I'd love nothing more than to have the grand final here in Melbourne, to have a MCG that was full, and to have people out doing all the usual stuff we do, whether it's visiting family and friends and having barbecues, or going to the pub to watch the game, or going to the ground to watch the game. I'd love nothing more to do that than to do that. That's just not safe, and therefore we can't do that. Now, if you were to try and do that, then just be certain about this. And there is no debate on this point. Be certain. That'll mean more people are in hospital, and the work our nurses have to do will be even harder. None of us should be working towards that outcome.
Are you considering mandatory vaccinations for places of worship? Is that in the roadmap at all?
The roadmap will look at mandatory vaccination in a number of settings. We've already foreshadowed that we'll be mandatory vax for all of our healthcare team, and that means the whole team. So it's not just people who provide clinical care, but the whole team that work at centres of care. Because if cases amongst cooks and cleaners and ward clerks and car park attendants and all that are just as important or just as dangerous as cases amongst clinical staff. National Cabinet will endorse that, I think, tomorrow as a national position. We've just spoken about construction workers today. There will be other categories of workers, particularly those who are moving about the community in this really important period, these next few weeks, when if we can keep the increase to a minimum and not have cases get away from us, then we'll have a smaller peak and less damage in our health system, if you like. It'll be less difficult once we open up. On religious gatherings, on other sectors, I'm afraid you'll need to wait till Sunday to see what some of that mandatory vaccination looks like. But it's occupational mainly. That's the main focus, because that's where the movement is, and that's where the cases will be.
What about mandating? Sorry.
Oh, but just like you were saying, you need probably 2 jabs to go to the pub eventually.
Yeah.
Will you need that to go to church?
We haven't quite settled on that, I don't think. But I think that we'll be encouraging in every setting we possibly can people to go and get a first dose, then a second dose, and acknowledge that just means you are at such reduced risk that it's worth doing that. It's an extraordinary thing to do, but it's worth doing. If you want to go to the pub, if you want to go to the G, if you want to do all sorts of things, then you'll need to be fully vaccinated.
What about mandating the movement of essential workers throughout this period? We've had the breakout on the V-line, train line, the construction site, a call centre, the fact that we've let a case go from Ballarat to Melbourne. Is there any scope for...
Well, there's a lot of people go from Ballarat to Melbourne. There's a lot of people move around the community because there are authorised, there are reasons. Like we haven't sealed off Melbourne, to the point where no one's going back and forth. The thing is that the Chief Health Officer, off the data, off what's happening, has made a judgment that it is too risky to have construction workers moving back and forth from Melbourne into regional Victoria and back again.
Why just regional? I mean, this is obviously it's a knee-jerk reaction to an outbreak we've seen in an unfortunate setting, but this could happen in any industry, really.
Well, I wouldn't describe it like that at all. It's not that sort of reaction. It's a considered decision based on what's occurred. And if it was to occur, if a similar pattern was to present in a different industry, then no doubt the advice would be the same, and we wouldn't hesitate to act. So it's not something that's been done in haste. It's been long thought about. There's been a deep engagement with the industry for weeks now, and today's the day to make the announcement. And I think what will happen is that those who work in the construction industry, and our government's done probably more than any government to make sure that industry thrives. The amount of work that we have provided in terms of construction, the amount of demand that we've underpinned, the confidence that we've built, the pay packets that are dependent upon everything from level crossings to road and rail, hospital and school builds, we're strong supporters of this industry, and they know that. I think what will happen is that many people who aren't yet first dose vaccinated and were maybe putting it off for whatever reason, or maybe they were caught up, maybe they've got an appointment or hadn't been prompted to do it. Supply was an issue. Now it isn't, and I think they'll flock to get vaccinated, their first dose, over the next seven days.
Premier, do today's freedoms mean that parents who take their kids to playgrounds can take their mask off to have a drink of coffee?
No. I'm not making any announcements today about masks.
No, I said just to be able to remove them to have a drink of coffee at a playground. Remember, there were those restrictions around playgrounds. Parents could take their kids there, but they weren't allowed to eat or drink while with their children.
There's no change to those rules. You've got a media release that details all the changes. We're not making any changes to the wearing of masks. The mask rules tomorrow are the same as they are now.
But if you're allowed to take your mask off to eat when you're eating at a picnic, are you allowed to drink a coffee or eat something while you're watching your kid at a playground?
Well, again, there's no changes to masks. There's no change, and playgrounds are, as we've discussed so many times, a unique setting in many ways. I'm happy to check with the Chief Health Officer about the consumption of food or the conduct of a picnic at a playground. A double if you like, a daily double if you like, Mark. I'm happy to chase that up, but I don't have an answer and I won't make one up for you. No, I understand the point of your question. If there was a picnic at a playground, what's the rules on masks? I will find out for you. I will absolutely find out for you. Whether it be coffee or something else, I will find out for you.
Is similar vein.
We might all need a coffee by the end of this or something stronger.
Speaking of something stronger, is there any change to the rules around drinking outside? Do they have to be alcohol-free picnics?
We're not changing any of those rules. So as they operate now, and they'll be very much dependent on the space that you're in, and a lot of that's sometimes local government rules as opposed to state government rules. This doesn't impact on that. What you could do in 2019, you can do now. We're not changing liquor licensing as part of this.
Because I think you did a couple of weeks ago ban drinking in outdoor areas. Is that ban?
And there's no, there's
that ban being overturned?
There have been a range of changes made to respond to risks, particularly in relation to playgrounds. And when playgrounds reopen, they reopen with QR codes, one parent, not two. It was never about the kids, it was about large groups of parents congregating. I'm not here to announce any changes to any of those rules. What I'm doing is what I've always done, announcing the things we've decided, and then when the invariable questions come, rather than me making it up on the spot, we will get you an answer. And if there's any confusion whatsoever in relation to who can eat and drink and where, we will chase that up.
Can I just ask on the enforcement of the vaccine status of people? I just want a hypothetical. If there's a big picnic that has like 10 or 15 people and police go and break that up, could the police ask the individuals their vaccine status if they're doing an enforcement operation, or is there a rule that police will not be asking about vaccine status?
No, there's no rule that they won't be asking about that. If you had a very large gathering that drew the attention of Victoria Police, then again, what they ask you and what discretion they exercise is a matter for them. But you are only supposed to be in that group of 5 adults, I stress, with any dependents you have from no more than 2 households, if you are double vaxxed. So I expect you might well get asked that. You might well get asked that. But we're being upfront about the fact that we're not going to have a police officer or an authorised officer in every park. And not everybody will be out picnicking, as important as the picnic questions are, but other people will just be out reading a book, or they might, whatever they might be doing, right? Police will not be out there checking every single one of those people. We're asking people to do what's safe, and that is to be in that group of 5 if you're fully vaccinated. If you're not fully vaccinated, then it should just be you and one other. And so there is an option. It's not like there's the fully vaccinated option or nothing. I expect that, I don't know, but I expect that New South Wales would be asking their residents to do similar things. They wouldn't necessarily be enforcing it at every single park. That does get quite challenging. The time will come, though, where there'll be software available and it'll be very easy for people to confirm whether they are or are not fully vaccinated, and they'll need to do that to access a whole range of different places, as we've talked about.
I think New South Wales is looking to use the public health directions to enforce that vaccine mandate to enter a pub or hairdresser, for example.
Yep. What
I'm asking is, for the outdoor rules currently,
yes,
do police, is there going to be a public health direction that gives police or any authorised officer the power to ask a person to show them their vaccine status? Or will that be a voluntary thing?
No. So there'll be public health orders that facilitate 5 people that are double vaxxed in a park, for instance. out and about doing that, spending that time together, which is currently not permitted by public health directions. It'll be permitted by public health directions, and I dare say that the terms under which it's permitted will be part of that public health order. If you ultimately, Paul, getting at, are police going to be recording whether people are vaccinated and privacy issues and those sorts of things?
Can they ask, really?
Well, they can certainly ask.
No?
I'm happy to come back to you on what police is kind of, what in a very deeply operational manner, how they plan to do that. I think the question didn't really come up in the walk from my office to here and the many lengthy meetings last night, because it's not like we're going to be out there enforcing it in every single park. We know and understand that police are not going to be able to do that. We are asking people to do the right thing and only to avail themselves of these outdoor socialisation options that are now available if they are fully vaccinated. If that's for the 5, if it's just you and one other person from another household, or indeed your own household, you don't need to be vaccinated. But we perhaps go and book a first dose appointment and get along and be part of it.
Is there a discussion of allowing outdoor gatherings would help discourage sort of illegal high-risk indoor gatherings as well? Does that factor into your consideration?
Oh, there's so many things that factor into the Chief Health Officer's advice. Obviously, look, it would be wrong for me to say that, that there aren't gatherings going on in people's houses that are against the rules. Of course there are. I'd ask people not to do that. You've now got an outdoor option. If you're fully vaccinated, you can have 5 people. If you're not vaccinated, you can be you and one other. The more people who do the wrong thing, you can understand why people want to connect with those they love the most and all those things, but the longer that goes on, the longer the lockdown will be on, the more cases there'll be. The rules are not there for someone else. The rules are there for each of us, and it's about making sure that our nurses don't have an impossible task with just way too many patients to treat. And they've got to make really difficult decisions, and you start compromising care, and no one wants their relative to be in that sort of circumstance. So we've all got to follow these rules for just a bit more. But Sunday we'll be able to talk about what the benefits of following those rules, and particularly the benefits of getting vaccinated, what that looks like in the rest of September, October, November, and indeed beyond.
Does Australia's deal with the US and the UK for defence and submarines at all impact Victoria's relationship with China and other Asian countries?
I'll leave it to the national government to speak about matters of foreign policy and matters of defence policy. What I would say, though, I absolutely hope and we'll do whatever we can to try and secure as much of the supply chain work as we possibly can. Victoria, we have such expertise when it comes to engineering, when it comes to electronics, when it comes to all the smarts that sit behind these very big machines. We would hope to be a really big part of the supply chain. We've got the skills, we've got the staff, we're absolutely committed to being part of it. So they're being built in Adelaide, that's fine, but there'll be a lot of, I think, different parts of that supply chain that we can do as part of that project, and hopefully we can get as many of those jobs as possible. Beyond that, I'd leave it to the Prime Minister and other ministers to speak to those matters.
There is speculation.
Confident in the state's relationship with sister cities, etc., in China?
So I didn't get the first bit.
You're still confident in the state's relationship with sister cities and otherwise in China?
Yeah, they're very important, and they have been very important for a long time, not just with that country or other Asian countries. We've got sister city arrangements, sister state arrangements with lots of different parts of the world. We trade with the entire world. My views on the importance of exporting products and therefore employing more Victorians are well known. As for matters of foreign policy and particularly defence policy, I'll leave that to the Commonwealth Government. That is very much their day job, and I've got plenty of other things to get on with. I've got a whole range of issues I've got to run down in relation to picnics and parks and playgrounds.
Are you concerned you'll be opening the door?
Just on the China stuff, just to follow on, sorry. Sure. There is speculation that this new security pact will anger China, though. So at state level, following from...
Yeah, but I'm not a spokesman for anyone other than our government. So people can speculate, but why would I add to that? I'm not here to add to the speculation of others. I'm here to make announcements, and I've just done that. And there's been some excellent follow-up questions, and I want to go away now and chase all the answers up for you. I'm not here to add to people can speculate all they want about those matters, but that's a matter for the federal government. The Prime Minister's made announcements. What I want is for that to mean more jobs in Victoria. And hopefully we can get a big piece of that supply chain, and it can be really good for engineering firms and for all sorts of other companies.
Just on nuclear power, are you concerned that this will be opening the door to having that sort of power in Australia?
Look, our view on nuclear power is well known. We are, I think, leading the way in terms of renewable energy. There's a lot of people who think that nuclear power is something that we should consider. I'm not one of those people. My view's been very, very clear over a long period of time. So this announcement's only been made this morning. There'll be lots of different opinions and views on it, and I'll leave it to others who've got the time to be, and indeed those who are responsible for matters of foreign policy and defence policy, and those who spend all their time talking about the geopolitical issues. That's not for me.
Albury's going into lockdown. Does that have any implications for people on the Victorian side of the border?
Yeah, I think that the Cross-Border Commissioner and the Public Health team will be working closely with our colleagues in New South Wales. Obviously, for give you one example, like we run the hospital in Albury. It's a unique arrangement. So the Victorian government runs a hospital in New South Wales, so there'll be a lot of people moving back and forth. I'm sure the New South Wales government haven't made that decision lightly in terms of the lockdown. They've got cases there. They've done what we did in Ballarat yesterday. We wish that community well. If there's any support we can provide from our side of the river, of course we would. But I think you're right, Bridget, there will be some knock-on effects there, because in so many ways they are in fact one place. I've heard that refrain a lot in recent times. So yeah, we might have to reach out and try and support them.
Quick question for Jerome.
Sure, any more for me? Very good. Got to go and get those answers. I'm off to do that now.
There's currently a backlog of 300 referrals, including 140 positive cases for health hotel accommodation for cases and their close contacts who can't safely isolate at home. What are the implications of that? Does that mean that there are people who are currently in places where they're not able to safely isolate who have COVID?
Yeah, look, I need to come back to you, Rachel, on what those numbers are. I don't have those numbers to hand at the moment, but look, certainly we have a preference when we can to use some of the hotel quarantine the hotel quarantine capacity that we do have in the state, to use some of that for Victorians who are finding it hard to isolate in their normal residence. Over the last 4, 5, 6 weeks, we've moved literally, probably small hundreds of people into either the health hotel or into our wider CQV hotels for that very purpose. Now, clearly, there are always going to be capacity limits, and one of the consequences of having far greater numbers now, 514 cases today, is that there'll be more people who we will have to support to isolate at home, when otherwise, if we had the capacity, we'd put them into a health hotel. So I can go back to you on the detailed numbers, but I think what we should all expect as we move forward, one of the reasons we want to keep our overall outbreak case numbers down as much as possible is that the very reality is that people who are now living with COVID, the 4,500 people who've now got COVID, we have to support more and more of them in their home. We will continue to do that, of course, but there are fewer options available, and it'll be similar for our wider health system. The more beds we take up with COVID patients, the more pressure the wider system will be under. What
are the circumstances of the people who usually need to be moved to those health hotels? Are they large households? Are they apartment building dwellers?
Yeah, it's a range of features. So normally in a situation we were in 4 or 5 weeks ago, when we were dealing with single figure cases or 10 cases a day, then you'd have the option, if you have either a large family who would struggle to isolate, or an individual case in a large family would struggle to isolate, you might go the option of moving the positive case into a health hotel, and maybe even moving the family into a wider hotel. There are situations where there are, if there are large numbers of people in a small dwelling, that would normally be a preferable thing to go and do. At the moment, certainly in terms of people living in high-rise accommodation, particularly public high-rise accommodation, we will continue to move those people into alternative accommodation wherever we possibly can, to minimise the risk of onward transmission.
I know we had a good testing day yesterday, Jerome. Right. How much can we scale up to? What's our capacity on testing? And are you still concerned that it's significantly lower than New South Wales per capita?
No. Well, look, I think we've seen today, a good 60,000 plus number of testing. That reflects the demand we're seeing out there on the system. I'm expecting to see some similar, big days over the days ahead, and the system is well able to stand up to that with 99%, 98% of people getting their test results the next day. And I think that's the hallmark of the consistency and the hard work of literally hundreds, thousands of people out there that make that system work. we've certainly got capacity to go beyond the numbers we did yesterday. We can certainly go to 70,000, 80,000 or so tests a day if the demand is there to go and do it. But we're not going to fill the system with random tests for the sake of it. We want to ensure that people who are symptomatic, that people who've got any reasons to be concerned, and that people who've been to exposure sites can come forward and get a test, and that's been the case we've had for the last 12 months.
Is there less testing in the north and west, or is it kind of similar to the rest of Melbourne?
No, we're seeing a really strong testing demand at the moment in the north and west. The north and west testing stations generally are some of the busiest testing stations we've seen in the last few weeks. Certainly Ballarat will be very busy today and over the next couple of days, and we'll manage our way through that as we always do. But we're seeing generally good demand across the network. I think my main call out would be, particularly for regional Victoria, what we tend to see is that as restrictions start to ease, then people start to come forward less for testing. We need, in order to protect ourselves, particularly for the really challenging few months ahead, people need to ensure they keep getting tested. It's the one way we understand where the virus is, and then we can support you and isolate you and stop it spreading further.
Do you think we could reach those 100,000 tests per day that New South Wales is currently achieving at all?
Oh, look, I hope not, frankly. I mean, I'd like to be in a position where we can hold down the caseload we're seeing right now. 500 cases a day is not a number where we want to be at. It's not a comfortable place to be. And of course, we expect to see some ongoing big numbers over the days ahead. But the more we can all work together to live within those restrictions, to hold case numbers down, the less pressure that the whole system is under. There'll be less pressure on hospitals, less pressure on our health workers, and less pressure on all of us. And it gives us more options over the days and weeks ahead. Just in terms of construction, in terms of access to vaccine, as the Premier said, we are now really requiring construction workers to get their vaccinations done. Just remind, the announcement we made last week, construction workers have got 4 testing station or vaccination stations they can go to get access to vaccination as a priority walk-up at the Eagle Stadium in Werribee, at Melton at the drive-through, at the former Ford factory in Campbelltown, and at the Heidelberg Repat Hospital. That capacity is there right now. I'd urge all construction workers to make use of that. There's a dedicated call line to get your vaccinations, and of course you can all join up and get into those 34,000 Pfizer bookings we have available across the rest of the state. So it's there, please use it. Thank you.
I wouldn't normally come back, but I've just worked out what Rachel was asking me before. It's in relation to the mask rules that we put in place when there were the pop-up pub crawls. I could understand that people will be very keen to get an answer on that, and I will get you one around the consumption of alcohol and the removal of a mask during the said outdoor activities we've just announced, whether they be picnics or otherwise. I'll get you an answer. Now, I'm sorry, it was a very late night. I'm now with exactly the program. Thanks.